everyone! I'm picky expert Dr. 𝗙𝗢𝗟𝗡, an aesthetic doctor from the Philippines. Everyone wants to have soft, supple, and glowing skin. Who doesn't want that, right? So we need to make sure that we have time, or we make time for both moisturizing and exfoliating. They are equally important so that we can achieve that younger looking skin. So why? Exfoliating, as we all know, removes the dead skin cells on the surface of our skin. So if left on their own, it can clog our pores and can contribute to the dullness and flakiness of our skin. And not only this, if you're already oily or acne prone to begin with, it will add to your greasiness, or it can actually contribute to your acne formation. So there are two ways of doing this. There is mechanical and chemical. So mechanical refers to the use of tools and machines that manually remove your dead skin cells. So you usually find or see this in clinics, like your microdermabrasion, or what we call here in the Philippines as 𝗙𝗦𝗕𝗦𝗧𝗏, exfoliating scrubs, granules, and beads. For chemical, on the other hand, that refers to your acids, your enzymes, and your retinoids. So this leads to the question of one of our picky users. Her picky username is 𝗧𝗜𝗠𝗘𝗦𝗧𝗏, and her question was, what age should we start exfoliating? I'm turning 15 soon and I have block pores on my nose and whiteheads below my lips. What product should I use? So actually, 𝗧𝗧, that's the best time to start exfoliating, because at that age, there are a lot of things happening in your body that can contribute to your oil production. So teenage years start at 12 and at 18. And during this period, there are a lot of hormonal changes occurring in your body. And these changes can actually influence or contribute to your acne formation. So learning how to take care of your skin as early as now is really recommended, because you shouldn't worry about the acne itself, but the scars that you can form from your acne later on. Okay, as for the second question, wherein 𝗧𝗧 wanted to know which product to use for her skin, there are different exfoliators, and knowing which exfoliator to use for your skin will still vary depending on your skin type. So, for example, you have dry skin. An exfoliator is very good for removing the dead skin cells, so it will help removing the flakiness that you see on top of your skin. In addition to this, if you really have dry skin, removing all of that will make it easier for your moisturizers to penetrate or to be absorbed better. So if you have dry skin, you might want to go for your glycolic acid, lactic acid, or mandelic acid. On the other hand, if you have very oily skin, like you said earlier that you have some blackheads or some clogged pores on your nose and some whiteheads below your lips, you might want to add some salicylic acid or BHA in order to penetrate the oil better. But if you have like active acne, your dermatologist might want to add some retinoids. So this is the reason why it's still better to see or consult with your dermatologist, because she would know how to combine your acids, and she would know if there is a need to add a retinoid, a prescriptive drug. The retinoid will help the exfoliator in preventing your acne formation. Why? Because it will replace the old ones with fresher or younger cells, and it will prevent the accumulation of the gunk in your pores, so that you don't keep on developing or keep on forming acne. And on the other hand, if you have very, very sensitive skin, you might want to stick with the mandelic acid or PHAs like your 𝗧𝗠𝗚𝗚𝗏𝗏𝗏. So they're very friendly and they're very safe for your skin. So I don't think you'll feel sorry for applying any of these. And you might want to go for really light mechanical exfoliation or microdermabrasion. So to answer Alma's question, how to deal with closed comedones and uneven skin texture during hot, humid weather. Are you from the Philippines? Because it's really hot and humid right now. So my answer to your question is to exfoliate. So exfoliators will help in preventing your skin from getting clogged, causing the closed comedones and the uneven skin texture. So let's say you don't want to get greasy throughout the day. You can apply a BHA or salicylic acid in the morning. That's if your skin is not sensitive to salicylic acid, because it's very good in controlling your oil secretion. And then if you can tolerate also applying 2 acids in one day, I suggest you also apply an alpha hydroxy acid at night in the form of gel, cream, or lotion to not only moisturize your skin but also to exfoliate your skin at night. How does retinol come into the picture? So retinol is a miracle ingredient because it can do a lot of things for our skin. So it can prevent the formation of acne, it can keep our skin young, and it can lighten dark spots. So there's a reason why people swear by this, because it can really transform your skin after using it for, let's say, 3 months or 4 months. So the thing is, the tricky part with retinol is the purging phase. So why do we have this purging phase? What is this purging phase? So why does this happen? So retinol replaces the old skin cells with the new ones, and this means that traveling from the bottom going up to the surface of your skin and pushes out everything that is in the way. So while it's pushing everything that's in the way, you can imagine your bumps creeping out. This is in the form of your blackheads, your whiteheads, and your papules. So since this period is so remarkable, researchers have named it retinization. So during retinization, you can expect redness, itchiness, flakiness, and all your bumps to come out. And since the mechanism of action of retinol is skin cell turnover or skin cell renewal, you really have to wait to finish at least 1 cycle, which is 21 to 28 days. And it can even last for 8 weeks. Sad, but yes. But don't worry, because it's very rewarding. After this retinization phase, these bumps should go away, should leave your skin without even exerting extra effort. So during this period, your skin might just be a bit more sensitive or reactive. So here are a few tips that I had for you. So first is, do not introduce a new ingredient to your regimen or to your routine while you are purging. Because at this point, you're still trying to get to know how your skin will respond to your retinol. And adding another one might just irritate your skin further. Second is that always keep your skin clean. Because if your skin is inflamed and then you get a cut or something and dirt comes in, it might develop into your breakouts or acne. Third is always wear sunblock and try not to go directly under the sun, because it might make your skin more sensitive or irritated. And then keep your linens or sheets clean so that the dirt does not make their way into your skin. Lastly, always drink a lot of water, because your skin needs to be hydrated or it needs water. So in response to picky users Callous Mom and Q208's question, I think it could be part of purging. So if you say that they are tiny bumps with no heads, they might be microcomedones, but these microcomedones are usually not visible to the naked eye. And if they are microcomedones, then you should continue your retinol so that the retinol can push it out further. However, it also might be a skin reaction or already a breakout. So it's really best that you see a doctor regarding your skin, because it's very difficult to tell between whether it's purging or it's already a breakout or a skin reaction. So here are a few things to take note of to distinguish purging from breaking out. First, for purging, if the lesions are concentrated on the areas where you usually get your acne, then yes, probably you're just purging. But if you see like it's coming out in everywhere or over your face, then it's probably a breakout. For example, for me, I get my acne on my left cheek. So that's where I usually purge when I apply retinol or hydroxy acids. And second, if it feels like a sandpaper or a mixture of your comedones, papules, few pustules, but rarely cystic. But when you are breaking out, it's usually very inflamed and very irritated. So you can expect more cystic acne. Third is that the cell turnover is faster when you're purging. So you will notice that your whiteheads might ripen faster than usual and they resolve on their own. But when you are breaking out, the comedones, they linger longer. They can even linger for as long as 2 months. And then lastly, it occurs after purging, occurs after a few days after your first application. So if, let's say, you've been using the product for quite a while now, for more than a month or so, and then you start seeing some acne, that's probably a breakout already, not anymore a purge. So going back to Callus Mom's question, if it looks more like a purge based on the points that I just gave, it is better to just wait it out for 6 to 8 weeks and just wait for it to all come out. But if it looks more like a breakout, then I suggest that you go and see your doctor because she might have to give you an antibacterial or a prescription medicine. So if you want to start with retinol, how do you begin? So number 1 is that you add it one by one. So the reason why it's important to introduce one product at a time is so that you can tell if what you're experiencing or the response of your skin is because of the retinol or by a different exfoliator. It would be very difficult to distinguish if you're putting everything all at once. So you need to do it one by one. Once you've already adjusted with retinol, then maybe that's when you can start adding a new ingredient into your regimen. And do know that when it comes to skincare, it's better to be safe than sorry. It's so much better to prevent than to treat. I'm telling you, you will be spending so much more if you damage your skin and you would have to treat it than if you prevent something from happening. So my tip number 2 for you is start with a lower dose or a less potent one. If you are a newbie to retinol, it's always safer to start with a lower dose. And this also answers the question of 𝗧𝗜𝗘𝗦𝗧𝗔𝗠𝗣𝗦, wherein she asked if retinol that is below 1%, will it still make an effect on your skin? The answer is yes. Even if it's just 0.1 or 0.3%, it will still have an effect on your skin integrity. However, if let's say you want to address specific skin concern like dark spots or uneven texture, you might want to work your way up. But of course, you have to do this slowly. Maybe let your skin adjust for 1 to 2 months first before you actually increase the dose so that your skin does not get surprised or it does not get so irritated. And another thing to consider is to start with retinol esters, because retinol esters, they convert 3 times before they actually get absorbed as your retinoic acid. And these include your retinol palmitate, your retinol acetate, your retinol linoleate. However, some researchers say, and some people who use also retinol esters say that you might not appreciate the effect that much because they're only tiny amounts of your retinoic acid that will be absorbed. So for my last or third tip, moisturize your skin. So it's important that you moisturize your skin to strengthen the barrier. And I suggest that if you have very dehydrated or sensitive skin, you moisturize your skin properly for at least 2 weeks before actually diving in. And once you begin, you can start by sandwiching it. So that means moisturizer, retinol, moisturizer, or moisturizer with retinol. And then let's say after 2 weeks, once your skin has adjusted to it, then you can start applying your retinol at the very beginning or at the very start, and then moisturizer. And let's see, even if there are a lot of testimonies that say that it transforms their skin in a few weeks, do not feel bad if you don't see any transformation in your skin right away. Those are the really blessed ones. results, you have to wait it out for at least 12 weeks before you can actually conclude whether you need a stronger dose or if you should just maintain your dose or completely stop it. So if you want to learn more about the science behind skincare, don't forget to like, subscribe, and hit the notification bell. Thank you!